Garrett County, Maryland sits on the eastern edge of the Appalachian Mountains. Home to the state's largest freshwater lake, it boasts a thriving tourism industry. Yet many of the county's 33,000 residents live in isolated communities, work in low-paying seasonal jobs, and struggle with intergenerational poverty. To bridge this gap, Garrett County has learned to rely on its greatest asset, its people.
Meals on Wheels.
A caring community that has united to reduce disparities in health, housing, and education, creating a culture of health for all its residents.
As a community, we don't look at our success based on how the upper 10% of the population lives or even the upper 50%, but what's our lower percent of the population, those people who are living in poverty, what's their life like?
I think this community has something special because the well-being of individuals affects everyone throughout the county, and so it's in everyone's interest to support that.
People see there's a need, and they don't wait for someone else to do something about it.
The two-generation initiative is focused primarily on the idea that we're working both with the adult and children simultaneously, because children do better if their families do better, and vice versa.
If they're working with a child that's in Head Start, they wrap services around the entire family, trying to make sure that that family has the resources in order to pull themselves out of poverty.
We have so many families who don't have the means to travel outside of their communities, so we had to find a way to get to them and to help them any way we could.
Wow, said Clayton and Desmond when they were finished. Wow, wow, wow!
Learning Beyond the Classroom is an outreach program. It's a bus that we've retrofitted into a mobile classroom, and we travel around Garrett County to 10 different communities. We educate them on nutrition, provide them with healthy food. We do school readiness activities.
What's missing? Dad! Holy smokes, that's right!
Provide opportunities for families to have social time with other families and kids as well.
We're really glad you came. We go throughout the whole year.
So through doing this, it just provides them with so many resources and so many connections. If we meet a family and they have a need, we will do anything we can to address that need.
Housing is one of the areas that Garrett County Community Action is really focused on. We really believe that housing should not be categorized by a label called low-income housing or public housing, and so we have designed it and we try to maintain it in a way that makes it a part of the community.
I'm low income and I'm elderly, and I knew I would never be able to afford a home of my own again. They were able to get me started on an independent living situation here at Meadows, and that's amazing.
We focus a lot on home ownership housing.
Positive credit information.
The county has said, we'll give you money for down payment assistance if you use that to try to bring and attract younger families to the county.
You'll have a realtor come and explain contracts.
So we've run an extensive home ownership program for first-time home buyers and people moving into the county that's resulted in over 400 first-time home buyers.
Thank you for coming today. What we're going to talk about is My Garrett County.
The Garrett County Planning Tool is an innovative approach to improve equity and build capacity, all things related to health.
There are a couple different ways to get involved. The first one is a community forum. That's basically where you can openly discuss any issues, concerns, or even talk about solutions that you have for the community. And this is all based on our community needs assessment.
And it helps because we can look at our results and measure those outcomes, and over time compare and see what programs are more effective, be able to change up if we need to, so that we're doing the best work that we can.
A culture of health really has to do with what a community does. It's looking at those things in the environment that allow a person to live healthy. Having access to fresh fruits and vegetables, being able to exercise, being able to take care of themselves.
The issues facing the Appalachian community, of course, are obesity, high blood pressure, diabetes is huge in this area. And I think all of those things combined can be affected by people being active. There was a debate over whether money should be put into the rec center or put into expanding a regional jail. After a very hot debate, the center was built. Our signature program is called the I Can Swim program. Every kindergartner in the county comes here for 1 week of swim instruction at no charge to the individual student or to the Board of Education. If we could save one life through that swim instruction, whatever the cost would be worth it.
Any of you, just by a show of hands, know somebody that's passed away from an overdose?
We have a Drug-Free Communities Coalition that for over 10 years has been working on tobacco prevention, marijuana prevention, alcohol prevention, opioid prevention.
If you see a friend or loved one, all right, and they're going down this path, they're using this, what are you going to do on them if you love them? You're going to snitch on them, right? That's the right thing to do.
We've invested highly in our community in prevention activities. We have great outpatient treatment and recovery coaches who work with individuals. The recovery coaches are people who have had an addiction themselves, and that's the only way we can get ahead of this epidemic that is really sweeping the country. It's a long, hard slog, but we have had a lot of success.
Cancer is one of the leading causes of death in Garrett County. We live in such a rural area that in order to get treatment, patients would have to travel about an hour, either east or west, of our hospital in order to seek treatment. So we were finding that many people were delaying treatment or they were not getting treatment at all. Patients now come to us. They are able to see a surgeon in this area. They see our oncologist. They receive all of their cancer therapies in this area. Being able to have their treatment here has been life-changing for many patients.
I am a community health worker. Some patients are part of the Well Patient program. We do home visits with them to make sure they have everything they need, education, transportation, medications. I mean, pretty much anything someone needs, we try to get them.
Hi, Nikki.
Hi, Joe. How are you?
I'm good. How are you, sweetheart?
Good. How are your sugars doing?
Pretty good, really. I always call you if I need transportation.
I know.
Yeah, because you're the only one I know for sure is going to check on it and make sure I have a ride.
And I think that us being community health workers, calling and follow up, it makes people feel like someone cares. And I think that's very beneficial to this community.
In the fall of 2006, we started the Garrett County Scholarship Program. And under that program, every kid that graduated from high school in Garrett County was eligible to go to Garrett College 2 years tuition free.
The Garrett County Scholarship Program was extremely beneficial for me because it provided me with a lot of resources that I wouldn't have been able to achieve on my own.
In 2010, we expanded the scholarship program to include what I would call trades, to help prepare those people for better paying jobs. At the time that we implemented this, we were the only county in the United States that offered a program like this.
Prelin is an absolutely amazing elementary school, and that's kind of indicative of a lot of the schools around the county.
People see it as a model school because we have such unique programs. We're not just thinking outside the box, we sort of live outside the box. Focus is truly on the kids and what they need. So in the agriculture program, the kids are responsible for feeding the animals, watering the animals, all of it. All right, how many eggs we got?
Got 2 right here.
Building character, you're building that work ethic. That every day, regardless of what the weather's like, those animals need fed. The barn needs cleaned out. So they put on their ponchos or their snow pants and out they come.
That's a good thought. Actually, potatoes are something a little different.
The whole idea in teaching the whole nutrition and the whole farm to table is because it's teaching them how to conserve and how to be sustainable, how to take care of yourself. I think it starts here, it starts at this young age.
I'm very optimistic about the future of Garrett County.
Everybody truly believes in what we're trying to achieve here in Garrett County. We're really trying to improve life for folks through any means possible.
It's a lot of people working together. It's a lot of coordination. It's a lot of collaboration. It's going beyond what's expected. That's what happens in Garrett County.